Hello and welcome to another medical moment. I'm your host, Dr. Valerie Walker. Today we're going to talk about fibroids, a thing that affects mostly African American women. Fibroids are usually just benign tumors of the uterus. They go by many names. Some people say uterine fibroids. Some people just clunk it down and say fibroids. Some people say leiomyomas. But the main thing we need to know is that all those names mean the same thing. So if you've had a friend or a cousin or a mama who called you and say, I went to the GYN doctor today and they told me I had a fibroid tumor. Well, the first thing you think to yourself, oh my God, tumor. It's cancerous. Most fibroids, unless it's what we call a leiomyosarcoma, are not cancerous. These are smooth muscle growths that they can occur inside the uterus. They can grow on the outside of the uterus. I've even had patients that have fibroids that grow down through the cervix. And just for your anatomy, just for a quick review, the uterus is that part of the female's body that holds the baby. So what happens when you get these fibroid tumors? Well, first of all, you need to know it varies from person to person. Some people can only get one fibroid and it's small and it never causes them any problems and they don't have no symptoms. Some people have many fibroids that give them symptoms, and we have seen fibroids bigger than grapefruits, and very large fibroids that's in just one female. It's so big that it almost mimics a pregnancy. So they can differ in number, they can differ in sizes. Some are small, some are large, but the bottom line is they can cause problems if they get too big and interfere with functions such as pregnancy, and you may think you're infertile because the fibroids are all in the way. So let's just talk about it. Let's just dive into fibroids and just talk about them some. So what are the symptoms? How would I know, Dr. Walker, if I even had a fibroid? As you're going to hear a lot of times on this show that I talk about, a lot of things has no symptoms. So the first answer is none. Just like high blood pressure, we call it a silent killer, because a lot of times you walk around and your blood pressure is sky high, and guess what? You don't know anything about it. So some of the symptoms, even with a fibroid, if it's very, very small, may be none. And it's estimated actually like about 50% of women over 50, believe it or not, has a fibroid. But because it's not giving you any problem, you don't report it to your doctor. Sometimes they're so small on a physical exam we can't even feel them. So fibroids are very common. And again, I'm going to push this in the African American female. Sometimes you can have heavy menses. Patients will come in and say, oh, Dr. Walker, I went to the ladies' room this morning and I was passing these big, huge clots. Whenever you pass a big, huge clots and the menses has gotten painful and heavy, you're probably going to have to get what we call an ultrasound to take a look to see if you, in fact, have fibroids. Another thing it can do, because they can cause such bleeding, and in the old days, they used to tell us, oh, menstrual blood is just dead blood. No, it's not just dead blood, because it can make you very, very anemic if you're bleeding from these fibroids. And that's why you see a lot of women eating big cups of ice because they are anemic. Now, I'm not saying every woman that has a big cup of ice has fibroid tumors, but if you're anemic, you're tuned to be driving through all these drive-through places, getting you big cups of ice. I have patients that tell me they can't even start work without stopping by one of the little well-known stores and then getting them 2 or 3 big cups of ice, and by the end of the day they've consumed that ice, and then they pick up some more on their way home. So if you eat ice like that, you may want to check with your doctor, because you may be anemic and you may in fact have fibroids, so you want to check with them on that. The other thing is, if they're large enough, they can put pressure on your bladder too, to make you have to urinate a whole lot. That could be a symptom of fibroid, and it'll give you all these frequencies, like every minute, I got to run to the ladies' room, I got to run to the ladies' room. That may be in fact a fibroid pushing back on your bladder. It can cause pain during sex because the size of them and all, and the mobility problems that you have during sex can make it very, very painful. So if you have very painful sex, there again, always call your doctor. Don't ever be afraid not to call your doctor. Give them your symptoms. Tell them what's going on with you so that they can check it out. Ignoring the system, anything in your body does not make the problem go away. In fact, half the time it make it worse. So anything you feel that's not you and just don't feel right, then you for sure want to tell your doctor about it. Always check with your doctor on everything you hear on this show. Low back pain, there again, because of the size and the pressure that these fibroids can put on the human body, you can have pains in your back. Also, it can make pregnancy difficult. I had a lady one time, she had a large fibroid, and they were going in to get the fibroid out, but guess what? When they got in there, they saw a baby too. So they hurry up naturally and got out of there. So they had the pregnancy going on and the fibroid at the same time, but a lot of times the fibroid, depending on where they're located, they can make pregnancy very, very difficult. So where are they located? Like I said, some of them can be on the outside of the uterus, some can be in the muscular walls of the uterus, some can be protruding through the uterus, and some can actually be protruding through the cervix. And when your GYN doctor, your primary care doctor, do an exam, they can actually see the fibroid. So that is something that you need to get checked out. So who's at risk? Who gets fibroids? Who's at risk for fibroids? Well, number one, African American females. You at a greater risk of developing a fibroid. The age is usually by the 40s to 50s, you may have some symptoms, and like I said, by 50% have a fibroid, whether they know it or not. Family history. I say all the time on this show, you cannot run away from the DNA. So there again, sit down sometime, ask the family, what runs in this family? Are the women in this family prone to fibroid tumors? You want to know these things because they do have a tendency to run in families. If you're overweight, weight bothers everything. I don't care what goes on with a person. Once you get past that ideal body weight, you just set yourself for every kind of problem in the world. You can get that too. So obesity, guess what? One that nobody knows anything about. Eating excessive red meat can contribute to fibroids. So you say, how in the world could that big old juicy steak contribute to fibroids? Well, what it is, fatty cuts of beef, really, really loaded with fat. And this fat has been associated with increased estrogen levels, and the increased estrogen levels actually make the fibroid worse and causes inflammation. And I tend to think that the whole human body, I've said this for years, is just an inferno on the inside. It's inflamed by all the things that we eat, all the things that we drink, and also the estrogen in production makes the fibroid worse. So actually red meat. So you want to cut back on red meat, and you want to eat more fish, and you want to eat more chicken. Another thing that can make it worse is diabetes. Diabetes make fibroids worse. Hypertension can make fibroids much, much worse. A thing called polycystic ovarian syndrome, and a lot of ladies know about that, are prone to fibroids. And even if they don't, we're not saying they give you fibroids, but we're saying these are the things that we see that are associated with fibroids. If you've never had a child, you're prone to having fibroid tumors. And also, when you get them, they also can put a lot of pressure on your rectal area too. So a lot of time when patients come in and tell me, I just feel all this pressure in my rectal area, that very well may be a fibroid tumor lurking somewhere. And even though I keep saying tumor, most of these things are benign. So just remember that. So don't get scared and say, oh, Dr. Walker said I got a fibroid tumor, it's bad. No, you talk to your doctor about it, and they will carve out the treatment plan that is best for you. Sometimes they can cause premature labor, if that's what happened with my patient, because of their position. And I always remember this about a fibroid. It always depends on, again, how many and where they are located. Those are the types of the problems that you will see. When we talk about things like treatment and what we're going to do about it. First of all, we just need to realize that the cause of fibroids is actually unknown. As you'll hear a lot on these shows, a lot of the things we talk about, we know the risks, which I just gave you, that's associated with fibroids, but just the cause, just to say, oh, last month at this time you got a fibroid because of, we don't know that. The cause of fibroids are unknown. The way we diagnose them, well, always a good physical exam. Always stay on top of your physical. That's number one way we diagnose most things, is just do a good thorough physical, because our physical will direct us into what kind of labs we need, what kind of x-rays we need. So check with your doctor, make sure your physical is due or not due, and get that done. And then your doctor's probably going to order some lab work to make sure you're not anemic, because remember I told you sometimes you can pass big clots of blood that's in the toilet. You know, you look around and you calling me talking about you hemorrhaging to death, and it's that fibroid, because they can cause some very, very severe bleeding and some very severe anemia. I've had patients get so anemic from fibroids that we've had to put them in the hospital and actually give them a transfusion, so they can really, really bleed. Again, determined on how big and where they are located. And trust me, there are some huge ones out there, really, really big. After we do our imaging studies, we can do things like a pelvic ultrasound. We can do a MRI. We can do all these things to try to diagnose what's really going on with you. And then we have to rule out other things to make sure it's just the fibroid, meaning we're looking for things like ovarian cancer, ovarian cysts, pregnancy, and all that. So we got to rule out things. So we rule in medicine, and we rule out. We rule in and we rule out. So you want to get all your diagnostic labs done and your x-rays. And finally, so how do we treat it if you do have a fibroid? Sometimes the fibroid is so small, it's not causing you any problem. Guess what? Nada. We don't do anything. It just depends on the severity and the symptoms that you're having. But if we have to, always first, the two treatments in healthcare is always either medications or surgery, or both. Medications, we can do NSAIDs. Those are drugs like ibuprofen and all to help with the pain, Tylenol. For sure, iron supplement. If you're getting anemic from the fibroid, we want to do some iron supplements on you. Be careful with iron supplements, though, because they can constipate you. So you want to stay up on your fiber. You want to stay up on your fluids, because and they can turn the stool dark. So if you're on iron and your stools turn black, don't think something grave has happened here. It's usually that iron supplement that does that also. And then we got GRH. These are hormonal treatment things. Again, you want to check with your doctor on all the treatments. We don't treat on there. What we do is just tell you what's available, what's out there, and questions that you can go and ask your doctor about. And then surgery. That's another option. Some women have hysterectomies. Years ago, so many women had hysterectomies, especially African American females, because of fibroids. But now they got treatments where they can do a myomectomy, where they can just get the single fibroid out if that's that. They can do an embolization of the arteries. We can go in under MRI and do some ultrasound guided therapy on it. So it's all kind of different things we can do, but we just don't have to always do a total hysterectomy. We don't do those as often as we did years and years ago. What you need to also know is fibroids will actually calcify after menopause. So a lot of times the symptoms that you're feeling will get better after menopause. So just remember with fibroids, mostly African American women, characterized by a lot of dysfunctional uterine bleeding, bleeding that you want to talk to your doctor about. If you're eating a lot of ice all day long, you want to talk to your doctor about that, because that may be a sign of anemia. And just know they're benign, and we have a treatment for you. I'm Dr. Valerie Walker, and this has been my story on uterine fibroids. Thank you.